there?
Students. 4, 5,
Students.
7 students.
7 students are coming. Okay.
In first year. Second year only 3, 4 are coming.
Okay. Okay, sir. Good afternoon to all. Today we have the MPC-013 psychotherapeutic method. Already sir has taken 2 sessions. Yesterday, morning session and MPC 11 and afternoon MPC 12. Today we have scheduled MPC-013. So psychotherapeutic method. So sir will already yesterday I have introduced sir. So Dr. Rafi sir will take the session 2 to 4. So if you have any doubts or clarification, ask the questions in and sir will clarify. ఎక్కడో రీసౌండ్ వస్తుంది somebody. Oh, wait 1 minute, sir. Wait.
Uh-huh.
మీ ఫోన్ సౌండ్ వస్తుంది ఈయన ఆఫ్ లో పెట్టారు కదా స్పీకర్ ఆన్ చేసి పెట్టా
Sir, now it is okay. Now you can continue, sir. I think,
Okay, sure, sir.
yeah.
Okay, sir, sure. Good afternoon, one and all. So today we are going to discuss about psychotherapeutic approach. So earlier we discussed about psychopathology, like how the what is the cause of different sort of psychological disorders, right? Now we will be looking at the treatment side. So how therapies are working and what are different therapies there in psychology, right? So first approach, what we are going to discuss is psychoanalytic approach, psychodynamic theory, therapy. Okay, psychoanalytic approach. Even we discussed this approach in psychopathology as well, but here we will be talking mostly about the therapeutic perspective. Just a second. Just give me a second. I will just change the location. Here is some noise. Okay. Yeah. So psychoanalysis. Psychoanalysis, founded by Sigmund Freud, as earlier discussed, explores human psychological functioning and behavior. So it talks about human psychological functions as well as behavior. So if you remember when we were talking about defense mechanism as well as psychosexual theory, so there we discussed that if a person is not able to fulfill his needs, any sort of pleasure, then it will lead to some sort of psychological disorder. As earlier class we discussed that. Here, what we are going to do is we are going to look into the therapeutic part, how psychotherapy helps individual to overcome from such problems. Okay, it comprises three main components: investigation of the mind, theories about human behavior, and treatment of psychological or emotional illnesses. There are at least 22 theoretical orientations within psychoanalysis. So it's not only by Sigmund Freud, there are neo-Freudians who also have contributed in this, influencing approaches to treatment and understanding of human development. Psychoanalytic theories can be categorized into different theoretical schools, emphasizing on the impact of unconscious element on mental health. So even further, it has been divided into different thoughts as Carl Jung came later, the Neo Freudians, even Sigmund Freud's daughter, Anna Freud have given some theories. Okay, influential theories within psychoanalysis include those addressing causes of syndromes and debates over optimal treatment methods. So there are theories within psychoanalysis which are addressing different syndromes as well as there is optimal debate on treatment method. Basic human drives. So first we'll talk about what a person requires. What are the basic human drive need? Sigmund Freud postulated two fundamental drives: motivation, human behavior, that is sex, and aggression, underlying all thoughts, emotions, and actions. As we all know that Sigmund Freud's focus was more on in his theory. He have highlighted sex, eros, and aggression, thanatos, underlining all thoughts, emotions, and actions. So he believed that whatever our thoughts are, emotions, and actions are, these are moving around these two things. So Freud emphasized sex as a crucial drive force in human nature. So what he said is sex is the crucial drive. People are going for that. That is the need they are required in. Drive to procreation and species survival evident even in animals. So he said the main purpose, the main aim is to create the new generations. Even this behavior is evident in among animals as well. Aggression or the death instinct serves as a means of self-protection. Aggression or death instinct, like when you are in a danger. Okay, means of okay, serves as a means of self-protection. There we try to protect ourselves and survive by eliminating threats. What we are doing is when even a normal person is in any sort of threat, what they are going to do is they are going to protect themselves by eliminating the threats. Whatever threat is there, so we will be trying to eliminate that threat. These drive encompass the broader survival instinct, combined the urge to stay alive, orchestrate, and defend against threats. So the main purpose of these is to stay alive, procreate, and to defend against the threats we are having. Observing the animal kingdom reveals these drive as central to behavior. So even it has been observed in the animal kingdom, they also need to just save themselves, just to have generation after generation, as well as to save themselves from the threat. Freud's theory suggested that complex behaviors like pursuing higher education stem from desire to improve oneself to attract mates. So, what according to Freud, again, it is according to Freud, he said somebody who is trying to get higher education, someone who is trying to become rich, someone who is trying to do something to be different or to be high in any sort of level. So, it all is because to attract the other opposite partner mate, ensure offspring and gain advantages over perceived adversities. So ensure offsprings like having marriage, getting offsprings and all, gaining advantage over perceived adversities. So getting the advantages from adversities, perceived adversity. Wherever they feel danger, they need to be secure from that. Structure and topographical model of personality. So, as we discussed this earlier, in this structural model of personality, it is also called a topographical model. In that, we have already discussed about id, ego, and superego. So, as I mentioned, that is pleasure principle. Ego is reality principle, and superego is morality principle. uh, this is structural model, and topographical model is where we are discussing about the levels of consciousness. Structural and topographical model. So in this we have already discussed about consciousness, unconscious, and pre-conscious. When a person is fully, when you are listening to me, you are able to understand what I am discussing, it means you are conscious. When you are in when a person is in coma, or when a person is unable to understand anything in deep sleep, then we can say it's unconscious. Pre-conscious is when a person is in altered state, for example a drunk person, right? So this already in detail we have already discussed this. Then again, coming to stages of psychosexual development, last time also I discussed this with the age as well. Oral, anal, phallic, latency, oral, anal, phallic, latency, and genital. Actually, latency is also there. So the age ranges for oral was 0 to 24 months. Then for anal, it was 2 years to 3 years. Phallic, it is 3 to 6. Latency, it is 6 to 12. And 12 onwards is genital. So in oral, forceful feeding, under overfeed. Okay, so in that, as I mentioned, it is the sucking behavior mostly, oral passive, trusting dependency, oral aggression, aggressive dominating. So this is showing how if it is not like underfeed, if the feeding is under, like it is not fully properly given, if baby is not fully or properly feeded, so what is going to trusting dependency will be there. Oral passive, it will be in passive. Overfeeded means oral aggressiveness, right? So these are the both hypo as well as hyper. Okay, both has the ill effects. So that's what we have discussed even in the last class. Then anal, toilet training, as we do. Too harsh, as I have given you last class example, that if parents are not allowing the kid to enjoy the toilet training, they make them punishment during that time. That will again have a problem. Are two legs. Then anal retentive, tiredness, obsessive compulsive. I told you last time that if they are having like that, then there is a tendency to be in OCD, like keeping things orderly and all. Then phallic, abnormal family setup leading to unusual relationships with mother and father. If there is an abnormal family setup where there is no proper guidance, leading to unusual relationship, as I discussed about three components over there, three types over there: oedipus complex, electra complex, and jocasta complex. Okay. And see, vanity, self-obsession, sexual anxiety, inadequacy, inferiority, and I. So if there is some issue in this, these are the problems which the kids are going to have. Genital, settling down in a loving one to one relationship with other, well adjusted, mature, able to love and be loved. Sexual instinct is directed to heterosexual pleasure. Okay, so this I think we have already discussed this, but still I want to give you a bit refreshed this thing examples about that. Okay, now we have defense mechanism. As earlier we discussed repression, denial, projection. I hope you remember that, and we don't have to discuss it again because we have a lot of syllabus ahead. So okay, I am skipping this. I have given you the examples as well for each of these defense mechanisms. Objective relations theory. This is another theory, objective relation theory, and adaptation of psychoanalytic theory. So when you are adopting a psychoanalytic theory, emphasizes that human psychology development is shaped through interactions with others. So what we believe in this is, so human psychology development is shaped. So whatever our uh, development. It is shaped in the interaction of environment with the interaction of others. Like social psychology, you have the concept of social psychology, how we interact with others. In others, it includes family, friends, relatives, everyone. It distinguishes between physical and psychological birth, with the lateral occurring over the first 3 years of life within social relationships. Okay, so it is distinguishing between physical and psychological birth, with the latter occurring over the first 3 years of life within social relationships. So, like when we distinguish physical birth and psychological birth, physical birth is what physically, like when a person is getting birth, right? Psychological birth comes later when there is a development in our psychological perspectives. Okay. During this period, a symbiotic relationship with the primary caretaker is established. So during this initial period, usually the kids are establishing a symbiotic relationship with primary caretakers. Primary caretaker either will be parents or even it will be caretakers, whoever is taking care of the baby, followed by separation and individualism. Separation and individual. When the primary caretaker goes away from the child, there is what separation anxiety. There is a chance of separation anxiety, and there is that individuality. Then that individualism comes there. The mother's emotional availability and ability to maintain separation are crucial during the symbiotic stage. So, in this stage, mother's emotional availability and ability to maintain separationness. So, when mom goes, usually when there is a child that will be waiting for the mother when she comes back. Okay. So, at that stage, if there is some sort of like there is no proper way to handle that, it will lead to anxiety separation or some sort of other psychological disorders. That's why some people will lack of empathy, sympathy, and other factors. Okay, boys must repress feminine components to become masculine, leading to aggression and power dynamic in relationships. So boys, as per this theory, boys must repress feminism, feminine components. So they have to repress, not suppress. They have to repress feminine components to become masculine. So usually, if you might have seen in our homes as well, if a small baby, boy baby is crying, we are saying you are not a girl. If a small girl, she is fighting with us, we are saying you are not a boy. It's not your job. So that way, what this theory suggests is boys must repress feminine components. What are the feminine components society have made so that they should repress to become masculine, leading to aggression and power dynamics. So aggression and power dynamics is usually associated with the masculine gender, right? Male. Girls tend to prioritize relationships over autonomy, forming a strong gender identity but weaker self identity. So, as per our society's expectations, girls are supposed to be like not to be autonomous, right? They are supposed to have usually even in earlier time. Now there is a scenario change. Earlier, if in a family there are boys and girls, first boys will have food and everything, then only whatever is remaining, girls will be taking care and having food. So that thing was there. Okay, nowadays entirely, because whenever I take class I used to ask such questions in class, so there is a change. Earlier it was, I have seen in my life that people, like if they have boys and girls, both son and daughter, boys will be studying in private institutes, girls will be studying in government institutes, or sometimes girls won't be allowed to study too much. Okay, you have to be with family, you have to cook food for your brother and all, you have for your family. So that's what we have, that social expectation, forming a strong gender identity but weaker self identity. Gender identity should be strong. You might have seen, if a girl at small age wearing clothes, boys clothes, they will scold in some sort of areas or in some sort of families. Okay, they will scold them or shout them, you should not, you are a female, you should not do like this. But weaker self identity, so self identity, they are not allowing the daughter to be independent. Father plays a role in separation individualization, offering an alternative identity for the child to identify with. The father again plays a role in separation individualization, offering an alternative identity for the child to identify with. Social patterns and experiences of caretakers influence the child's development. The way caretakers are taking care of the baby, their experience also influence the development. So environment, as we have seen, nature versus nurture, environment also plays very important role in the development of a child, contributing to the information of human nature. Right? Then we have another theory that's called attachment theory, which was given by John Bowlby. So what attachment theory says? Attachment theory developed by John Bowlby diverged from psychoanalytic theories and emphasized the child's real experience and external world in healthy development. So it is diverted entirely different what Sigmund Freud or psychoanalytic theorists have talk about the child development. So John Bowlby discussed about the child experience or attachment, different attachment styles in children. Okay, so what he suggested, the children's real experience and external world is healthy development. So their real world and experience is actually healthy development. In what way they are being developed. Attachment behaviors aim to achieve a psychophysiological state related to being in close proximity with the mother or caregiver rather than merely seeking objectives. So, attachment behavior aims to achieve psychophysiological state related to being in close proximity with mother. So usually when kids, usually you will see it will give them more pleasure to be attached with the mother or caregiver rather than the objectives, even if you are giving them toys, dolls, or any other objectives to play. Okay. Adults may resort to psychopathological cure basic phenomena when stressed or threatened, such as substance abuse as a shortcut to the physiological state of security. So people being in adulthood are having issues like what has not been fulfilled in the earlier stage, then that will lead them to isolation, and that isolation will lead them to engage in behaviors like substance abuse, smoking, drug, and all. Ainsworth et al. Worked refining attachment theory through the study of infant response to the strange situation test, leading to classifications of attachment style. So Ainsworth did one experiment in which he tried to identify the infant's response in terms of strange situations, like how they will be reacting in strange situations as compared to where they are attached or where they are uh, aware of. On that basis, he has given some attachment styles. Adult attachment categories include secure autonomous. So one they have given secure autonomous, secure and autonomous. There is security as well as there is autonomy. Insecurity dismissing. Another is insecurity dismissing. Then we have preoccupied and disorganized. Preoccupied, and then we have disorganized oblique unresolved individuals. So there can be secure autonomous. Secure autonomous means when you feel secure and you feel independent. Insecure dismissing means when you are not secure and you feel dismissing. Okay, you don't feel prioritized. Preoccupied means when you are occupied in something, and disorganized when there is no organization or when there is no pattern of something. Okay, and unresolved individuals where there are always doubt which is not clear. Empirical research supports attachment theory, demonstrating that expectant parents expectant parents mental models predict subsequent attachment patterns. So there are empirical research. Empirical researches are those researches which are evidence-based researches. So what they are suggesting is expectant. Those parents who have expectations, mental models predict subsequent attachment patterns. So there are subsequent attachment patterns, different patterns in attachment. Okay. Psychoanalytic and psychodynamic therapy. Psychodynamic therapy, yes. Basic trends. So the unconscious. Already we discussed what unconscious is. Development perspective, how development like through lifespan from conception till death, the level development perspectives. Subjectivity, as I told you in psychodynamics or psychoanalytic theory, it was more subjective. Even in last class we discussed that there is not much empirical studies. It was based on the subjectivity. They were interviewing some patients, on that basis they have given that, but it is very difficult to generalize. Then we have transference. Transference is another concept where if there is a client and the counselor, so when they are going beyond the professional relationship from client towards counselor. Okay. Resistance, when there is no progress in counseling session, when there is a resistance of, for example, a person is drug addictive and they are not able to recover from that, so they are resisting. Or resistance, you can say, in other words, for example, if a person is going to a doctor, doctor will always ask, okay, when did you had last time medicine? So if you say that I had 6 months back, then even they will ask you what was the dosage. So to understand that all, that's what resistance is. For example, a small kid, what sort of medicine doctor will give them, and if it is an adult, if it is an old age, so there will be different sort of resistance with each person individual. Then we have countertransference. Countertransference is again when it is the relationship goes beyond from the counselor side towards the client. Psychic determinism. Okay, I think these are ahead also discussed. Then we have components of psychoanalytic and psychodynamic psychotherapy. Three essential features of psychoanalytic methods are interpretation, including classification, confrontation, and interpretation. Classification, clarification. Clarification is first to make the things clear. Confrontation, if there is some doubt or if there is something, we need to face that, confront. And then there is interpretation. Interpretation means perceive. How do you perceive that? Technical neutrality and self disclosure. Technical neutrality means when you are like uh, when you are able to be stable. For example, it's not going too much emotional, or it's not coming too much like emotionless. So you need to neutralize that. Neutralize means optimal level, or it is homeostatic balancing. Self disclosure in counseling, especially when you are doing counseling, so sometimes what happens is a client is coming to you and they are unable to reveal what actually is going on. Usually when even I do counseling, when students are coming to me, they won't be able to reveal that they had an issue, because they may sometimes hesitate. There are a number of factors. So I will say, oh, why you are hesitating to talk about what happened? Oh, you have been like some issue with your friend, boyfriend or girlfriend. So the self disclosure, oh, when I was doing graduation, I too had the same issue. So that will help them to open up and to discuss the things. Otherwise they will feel like, obviously there are always age related gap, gender related gap is there when there is a counselor and a client. So to make them more comfortable, sometimes self disclosure help plays a very important role to make them open about the problem they have. Distinctive features of psychodynamic techniques focus on effect and expression of emotion. So it focuses on the mood as well as expression of emotions. So that's why they have given free will. You can open up, vomit, all exploration of attempts to avoid distressing thoughts and feelings. So you need to avoid distressing thoughts, whatever is giving you anxiety sort of thing, then you can avoid that. Identification of recurring themes and patterns. Try to understand which pathway it is taking, right? Discussion of past experience, developmental focus. So in develop discussion of if you had earlier this situation, for example, a client is coming to me saying that I have next time exam, I am feeling tomorrow I have exam, I am feeling so tense about this, so what I am going to do, how I am going to do. Then I will ask, okay, when you had last year exam, how did you deal that time, so that we will get which strategy that person has used and which has worked on that person most appropriately. Focus on interpersonal relationships. Interpersonal relationships is how is your relation with your colleagues, how is your relation with your parents, or how is your relation with your friends. Focus on the therapy relationship. Again, another important thing, therapy relationship. It should not go unprofessional or it should not go beyond that, right? Then exploration of fantasy life. I always like, what are fantasies you have, you need to explore in on that exploration. Insight psychotherapy, interpersonal psychotherapy. Okay. Insight psychotherapy. What is insight psychotherapy? Insight psychotherapy is an umbrella term used to describe a group of different therapy techniques that have some similar characteristics in theory and thought. So this is an umbrella term. Why umbrella term? Under that there are so many things coming. That's why it's called as umbrella term. Used to describe group of different therapy techniques that have some similar characteristics. So under that there are group of therapy techniques which has some sort of similar characteristics in theory and thought. Insight therapy assumes that a person's behavior, thought, and emotion become disordered because the individual does not understand what motivates him. So, what this therapy believes that is, कि individual's thoughts, behavior, and emotions become disordered, become impaired because the individual does not understand what motivates him, what I need, what is my desire. When I don't understand, then my brain, my thoughts, my emotions will be impaired, especially when a conflict develops. When I am in a conflict, tomorrow I have exam, I am in a conflict, right? How to do it? So in that time there is a probability of getting this disordered thought between the person needs and his drivers. My need is something and my drive. How you can differentiate between need and drive? That is important to understand over here. So my need is I need to fulfill my hunger. I can have, there are a number of options. There are Rajma Chawal, there is biryani, there is Maggi, there is paratha, so anything. But now I had to look into the finance thing. I had to look into the other aspects, what will be appropriate for me. But my drive is to go to some best restaurant and have food there. That's what drive. Need is like to what extent what we are going to have. Okay. Then the different types of insight therapies are described below. Psychoanalysis, as we discussed, psychoanalytic therapy. Another one, existential therapy, person-centered therapy, which is from humanistic approach. Behavior therapy is gestalt therapies. Okay. So analytic therapy. Analytic therapy developed by Carl Gustav Jung combines Freudian and humanistic psychology. So it was an approach, combined approach of both humanistic and Freudian approach, psychoanalytic as well as humanistic school of thought from both school of thoughts. Okay, emphasizing the importance of the unconscious in human behavior. So both have emphasized on unconscious in human behavior. Jung introduced the concept of collective consciousness. So he said about collective consciousness. Collective consciousness is what all people are thinking is good, moral, or ethical. A reverse reservoir of sharing experience across humanity, containing positive and creative forces rather than solely sexual or and aggressive ones. As you remember earlier, we discussed Sigmund Freud mainly focused on sexual and aggressive ones, but here he talk about positive and creative forces as well. So personality types in analytic psychology are organized into extroverted and introverted groups. Extroverted are those who are like publicly speaking people, who are well adjusted with people in crowd and all. Introvert are who are isolate, who don't have good friends, who don't make friends, who don't make up with others. They will be doing individually all the things. They will not easily mingle with others, with emphasis on purpose, decision making, and goal setting. Okay. Jungian therapy focuses on analyzing unconscious process to integrate them into conscious thought and address conflict. So what he said, what Jung's approach was, he tried to analyze unconscious process and convert it. For example, I have something in unconscious. I like something. I want to have something. So as per him, he said, bring it to the consciousness and then address this conflict. Okay, personality is explained through three levels of consciousness: the conscious, the personal unconscious, containing repressed conflicts, and the collective unconscious. As per Jung's personality theory, so he mentioned that it has personal unconscious, it has collective unconscious, right? Um, Personal unconscious. The conscious, the personal unconscious, and the collective unconscious, as per Jung, who was Neo-Freudian. Then we have another therapy, very important therapy, existential therapy, which was actually given by existential school of thought. Also, we have the most famous psychologists who have worked on this is Roll May and Viktor Frankl. So I hope you might have read about the book Man's Search for Meaning in Life, that was written by Viktor Frankl when he was in jail, when his family was destroyed. So he wrote a book, and it is very famous book, Man's Search for Meaning in Life. Okay, so existential therapy roots in existential philosophy, focusing on the importance of existence and one's responsibility for their own psychological well-being. So what existential therapy discusses is, it focuses on importance of existence, who I am, or who am I, right? That's what my existential question is, who am I, right? So he focused on that, and as per him, as per existential school of thought, one is responsible for their well-being. If I am sad, it is because of me, it's not because of you. If I am happy, it is because of me, it's not because of someone else. So as per existential therapy, if you understand who I am, then you will be able to understand your responsibilities. Unlike other therapies, existential therapy emphasizes life themes over specific techniques, encouraging self-awareness and reflection and human existence. So what it said कि you have to focus on self-awareness. If we even compare this with Buddha's this thing theory, Buddha also said happiness is within us. Okay, so same way existential approach also says that it is within you. Okay, unlike other therapies, existential therapy emphasizes life thing. Okay, specific encouragement, self-awareness, and okay. So what they focus on, encouraging self-awareness. So they focus on, if you understand yourself, then it would be great. And reflection on human existence. Reflection on human existence. Why I am existing. You need to have a reflection. Who I am, why I am, what is the purpose of my life. Okay. Early existential therapists trained in Freudian psychoanalysis disagreed with Freud's emphasis on biological drive and unconscious process. So, these earlier existential therapists who were trained in Freudian psychoanalysis disagreed with the opinion of what Freud talked about biological drive and unconscious process, preferring to see patients as they were in reality. Okay. Concepts of existential therapy emerged from European philosophers like Kierkegaard, then Jaspers, then Steyer, even Viktor Frankl, and this Rolme was again the famous. The therapy emphasizes the uh, therapeutic relationship and explores common existential themes in patient's life, helping them realizing their full potential. So it usually helps the people or patients to understand their own potential, how much potential they have, and that will help them to overcome from their difficulties. Sometimes we don't know who we are, So it helps them to first understand that self realization or self knowledge. Therapists in existential therapy must be fully aware of patients and their needs to facilitate self awareness and personal responsibilities in the patient's life. So, those who are practicing existential therapy, they should be aware about patients and their needs. What is their need? It's not again here talking about desire. Desire is different than need. So, they should be aware about their needs to facilitate self awareness and personal responsibilities in the patient's life. Then we have PCT, person centered therapy, or it is sometimes called client centered therapy. So don't get confused. Even if it is coming client centered therapy, it is same. Either person centered therapy or client centered therapy. Once called non-directive therapy. So it was once called even non-directive therapy. Then client-centered therapy. After that, it was client-centered therapy. Then person-centered therapy was developed by American psychologist Carl Roger. Okay, so non-directive therapy, client-centered therapy, as well as person-centered therapy. All names are for same, and it was developed by Carl Roger. He was from humanistic thought school of thought. Person-centered therapy looks at assumptions made about human nature and how people can try to understand these assumptions. So, what are assumptions people have made, and how people are supposed to look into that assumption? Like other humanistic therapists, Roger believed that people should be responsible for themselves. Even like existential therapy, existential and with this humanistic approach, there were similar thought process. So he also mentioned in this that people should be responsible for themselves. If something is good happening with me, it is me because of me, or if something is bad happening to me, it is because of me only. Even when they are troubled, even if I am in a trouble, still it is my fault why I am in a trouble, as per person centered or humanistic approach. The components of the idea therapeutic climate include the following: genuineness from the therapist. So the therapist, even they have given some sort of like characteristics of a therapist in humanistic approach. So number one is genuineness from the therapist. So therapist should be genuine. Unconditional positive regard for the client. So therapist should have unconditional positive regard. What is unconditional positive regard? Unconditional positive regard is like helping people without any this thing. It's not like they won't charge the fee. Being a clinical psychologist or a psychotherapist, you have to charge it. But rather than that, other than that, there should be unconditional positive regard for the client. Then empathy for the client. You have to show empathy to the client. Empathy simply means being in others' feet. The therapeutic process in client-centered therapy, the therapist clarifies rather than interprets the client's experience. So here, therapist tries to clarify rather than interpreting the client's experience, which forces clients to develop their own solutions. So by that, it will help the client to develop their own solutions. As I earlier also mentioned, if we ask them, okay, how did you deal previous time? So they will remember, oh, that time I did like this. That's what helped me. Before that, I did like this. So you will get even solutions from the client. Cognitive therapists. Aaron Beck, a very famous therapist, again, very famous person in psychology. He has done a lot of contribution, especially CBT related and Beck's depression inventory, anxiety inventory. Okay, in 1970s to 80s, put forward this therapy and stated that cognitive psychology tries to look at how people process information. So cognitive therapies, what was his objective or aim? He tried to understand how cognitive psychology tries to understand the process of information, people process of info, how they are processing the information. Then comes to behavior therapy. There are three important assumptions in behavior therapy. The problematic behavior is a product of learning. Remember little Albert with his conditional fear of rats? That was a learned phobia. So, what behaviorists believe, problematic behavior is a product of learning. So, they say if I have a problematic behavior, for example, if I have a fear, it is learned. So even you might have seen in your house, if there is a small kid, when they are not eating food, what you will say, dog will come, cat will come, rat will come, you have to eat. So that is what learned fear it is. That's what behaviorists suggested us. Even there was a, little Albert, there was a experiment with little Albert. Okay. That was a learned phobia. Learned behavior can be unlearned. Another important point what behavior therapists believe is learned behavior can be unlearned. What we learn, it can be unlearned. Remember little Peter, whose fear of white rabbits was vanished with the use of milk and cookies as a reinforce. So another little Peter was there with whom they have done the experiment who has fear of white rabbits. It was vanished with the use of milk and cookies, okay, as a reinforcement. So that's what they say. Behavior, problematic behavior is product of learning, and learning can unlearn problematic behavior. Okay, then another is problematic learned behavior can be extinguished over time, so it can be reduced over time. The following are the behavioral therapeutic approaches. Number one, systematic desensitization. Systematic desensitization means when you are step by step guiding with in there we have hierarchy, especially it works with OCDs as well as with phobias. Okay, for example, a person is having phobia of flying in aeroplane. They get a lot of anxiety when they are flying in aeroplane. So what we are going to do in that situation? Being a psychologist, if we are using systematic desensitization, so in that, what we are going to do? We will be planning a trip. We will not directly put him on the aeroplane. Okay, we will not do flooding. Okay, so what we are going to do is we are going to introduce about the aeroplane to the client. So we can plan a trip to such a place where aeroplane is the only means. For example, to some island. Okay, so then we have to show the dummy, okay, we are we are planning that. Then we will be showing, okay, we'll go there. We will show like, what is this? Toy farm, this is plane, this runs like this, and we have to see the anxiety level of the client at the same time. If it goes exceed, then we have to give relaxation techniques in between. Okay, after that, next time we'll plan, okay, with the permission of the airport authority, you can take the client and show the airport, and even you can sit in aeroplane in next session, then third session, and again we have to measure that to what extent it went up anxiety level. So if it is like bearable, then go ahead. Next time along with counselor or along with the person who is going to guide that person, will take him in the airplane. So that's what systematic desensitization is. We are giving them exposure step by step towards the fearful stimuli they have about. Another is aversion therapy. Aversion therapy is also based on the this theory, operant conditioning, reinforcement, and punishment. So, for example, aversion therapy is, for example, I'm a smoker person. Okay, I'm smoking or drinking. Whenever a person, I just a second, what message I go? Okay, attendance message. Huh. Okay, so. Uh, Yeah, aversion therapy is when a person is smoking. So what will happen? There will be a therapist or a psychologist who will give. Whenever I try to smoke, I will get a small shock, small current. If you remember, we had discussed about the uh, about about this dog experiment or rat experiment, classical conditioning or operant conditioning. right? So same way, what is going to happen is if I start smoking, if I smoke, that time only I will get current again next time. So there will be a time, once I practice it for 1 month or 2 months, whenever I even get smoked my lip, I will get current, even though not in reality, but it will be conditional. So I will be becoming afraid of cigarette because I will understand that this cigarette is going to give me the current. So that helps us to like overcome from any sort of addiction, like drug addiction. It can be alcoholism, it can be smoking as well. Social skill training is another training which helps us to develop our skills. For example, we have a fear of standing in front of morning assembly and all. So if we get that social skill training, how to train ourselves or how to get rid of that all shyness, or the when we are having low self-esteem, when we are having low self-confidence, so this all can be treated through social skill training. Again, it's a behavioral modification of gestalt therapy. Now another therapy is gestalt therapy. Gestalt therapy focuses on the wholeness of personality and emphasizes current life experience to help individuals balance conflict feeling and function between better in everyday life. So what actually gestalt therapy is? Gestalt concept is based on whole is greater than its parts, right? So what they believe is whole is greater than its parts. If you see this pen, if I open it into different parts, there is no use of this cap without this pen, right? So that's what gestalt therapy says, or gestalt psychologist says, whole is greater than its parts. Are you getting? So if there is one part, there are 10 parts of this pen, whole being a pen is greater than its parts. That is what concept of gestalt is. Gestalt psychology. Okay. Developed by Friedrich. Okay. Gestalt therapy emphasizes increased awareness of unacknowledged feelings and parts of the personality previously denied. So what he says is you need to increase unacknowledged feelings which you have not acknowledged. That feelings you need to increase awareness, and parts of the personality previously denied, whatever previously you have denied, you focus on that. Gestalt therapy integrates humanistic and existential aspect. So they include both humanistic as well as existential, with parts rejecting some basic concepts of psychoanalytic theory. So again, they have rejected some concepts in psychoanalytic theory. The therapy view the therapy views people as basically good with psychological problems stemming from frustration and denial of innate goodness. So they overall view people as they are good, but whatever their problems are, it is because of their frustrations and denial of innate goodness. When you are not giving acceptance, or when you are not appreciating goodness in me, then that will lead to a problematic behavior. Therapists focus on patients creative aspect of rather than problematic aspect part. So what they are asking is, for example, if a person is coming with, I had this problem, I had this problem, I had this problem. So being a gestalt therapy, I have to say him that even you have this good thing in your life, you have this, you have good self-esteem, you have good confidence level, you have good achievement scores, you have good this thing. So that's what it is not focusing on only the problem, but it is focusing on the achievements or the uh, mm, good things the individual have or having. Okay, the therapy discourages dwelling on the past or asking why, as it seems to an attempt to escape responsibility from present decision. So even this therapy discourage, it is not encouraging about what happened in past. You will say last year I failed in one side, that is past, that you leave. Okay, awareness is considered creative in gestalt therapy curative in gestalt therapy. with techniques like the empty chair technique used to confront and overcome unresolved feelings or conflicts. Empty chair technique. There is a technique in psychology. We use it to make people understand or to unresolve their feelings or conflicts. Interpersonal psychotherapy. Interpersonal psychotherapy is a short term therapy effective in treating depression, typically involved up to 20 weekly sessions. 20 weekly sessions. So 20 sessions it takes. It focuses on addressing interpersonal issues that contribute to depression. So for example, a person is having depression. So what it does is it will address the problem in the issues, interpersonal issues within 20 weeks, weekly one session, and it will contribute to it will help to overcome from the depression, and it will try to resolve disputes, role transactions, and grief beyond normal bereavement. Interpersonal psychotherapy targets specific interpersonal issues identified during the initial stage. So, in initial stage, when you are sitting with the counselee or client, then you will be discussing and you will target what exactly is this. So, usually, if there is a conflict between father and son, so why it happened? So, it will try to focus on the main persons in that. Okay, aim to improve interpersonal functioning to alleviate depressive symptoms. So, when you are trying to eliminate the depressive symptoms, you have to increase the relationship between the people, or you have to enhance their relationship. Studies have shown interpersonal therapy to be as effective as antidepressant medicines in treating depression. So, therapists or studies, empirical evidences have shown that its effectiveness is as well as you see the medication you are taking for the depression, and it can also be used in conjunction with medication. Even if there is a medication as well, in with that as well, it can go parallelly to treat a person who is having depression. It was developed by Gerald Kellerman and Myrny Weissman. Interpersonal therapy has been used in various populations, including adolescents, older adults, HIV patients, HIV positive patients, and those with dysthymia, bipolar disorder. Dysthymia is again type of depression only, which is for a long time. Bulimia nervosa, it is a eating disorder. So it has shown very good results over these disorders. Interpersonal therapy, psychotherapy assumes that a person's mood and interpersonal events are interdependent. So the mood and the relationship. See, usually we say, "Na, he is very angry, so we can't ask anything for favor," right? So this is not the right time to talk to this person because that person is angry. Same thing. What it says, personal mood and interpersonal events are interdependent, focusing on improving interpersonal functioning to elevate depression. So it focus on it to elevate the depression. It is time limited, typically consisting of 12 to 16 weekly sessions with a focus on current interpersonal function. So it is time limited. It takes less sessions, typically consisting of 12 to 16 weekly sessions. Okay, with a focus on interpersonal function. So most focus will be interpersonal relationship function. Unlike other therapists, interpersonal therapy does not delve extensively into past but rather focus on current relationship. Again, like other therapies, it is not going to discuss about the past, how was yesterday. It talks about today and how it should be. Okay, techniques used in IPT includes directive and non-directive exploration. Okay, clarification, encourage expression of effect, communication analysis, behavior change techniques, and addressing resistance in the therapy. So these are the things which are being addressed in this therapy. Therapists in IPT monitor transference and countertransference and avoid advising dependency patients, instead fostering problem solving skills and independence. So In this, they are not like they are more focusing on transference and counter-transference and avoiding advising dependent patients. So sometimes you might have seen when you are getting clients, they will be calling you night 10, sir, I am not feeling sleepy, what should I do? If you are saying, okay, okay, no issue, I am also in the same situation, let's talk. So then you are going beyond the border. There should be a limit, there should be a border, there should be a barrier in the relationship between client and counselor. Short-term psychotherapies, others, okay, just a second. Okay. So, other than these, there are short-term psychotherapies. Short-term psychotherapies has become increasingly popular over the last 2 decades due to several factors. So, what are the several factors that we will discuss? Short-term psychotherapy. See, when if there is a long-term, last time during last decades, we used to watch a movie for 2 hours, 3 hours. Okay, but right now you see people are not having that much span of attention to watch a movie continuously for 3 hours. But nowadays, short reels people are watching and spending a number of time on that, right? So short-term psychotherapies also have some sort of popularity because of a lot of factors. What are the factors? We will see. Pressure for cost effectiveness. Healthcare industries have pushed for more cost effective approach to therapy, leading to the adoption of short term methods. So, if you have short term psychotherapy, you have to pay less because it will be for few sessions only. It depends again. So, you are able to save money in that. Refinement of techniques. Advances in psychotherapeutic techniques have made therapy more efficient, allowing the meaningful progress in shorter time frame. Refinement of when you are considering some sort of technique from big technique. For example, there is CBT, which is you. If I am making a short-term technique from that, so I will take only the important and more focused content from that, which will help the client to overcome as fast as more. Then influence of research trials. Even research trials often focus on short-term approaches when them okay, which then becomes influential in shaping therapeutic practices. Okay, even researchers. For example, I had to collect the data and all. It also will be very helpful for me to finish a short-term therapy's research data collection as compared to if it is a long-term. Challenge to the idea that longer is better. There is a challenge to the it is a challenge to idea that longer is better. The conventional view that longer therapy is always better has been challenged by evidence suggesting that shorter term therapies can be just as effective. As you see nowadays, the reels we are watching, very short reels that are more effective than a movie of, even if news and something you see, if you it is 20 minutes, 30 minutes. Nowadays people don't have that much patience to watch full news or something. We just want cracks of news, so we will be watching top 20, top this thing, so we always prefer that. So same way it has challenged the long term, even though it was mentioned that long term therapies are best or better than the short term, but it has challenged that. Intrinsic merit of brief approaches. Many therapists recognize the inherent therapeutic potential of brief therapy and choose to adopt it for its own merits. Okay, so even a lot of therapists have recognized inherited therapeutic potential, like the how people are having the potential to go for therapy, and they have even adopted the brief therapy as well. Defining features of short-term therapy is time limits. So it is time limited. Like for example, it's not you have to spend a lot of time over there. Therapy focus. So even when it is a short term, it will be focused more. If I had to finish the therapy which was of 1 hour, I had to finish in 20 minutes or 30 minutes. So it will be more focused. It will be more objective in nature as compared to the lengthier one. Therapist activity. Even the activity will be more focused. Range of applicability. So, to what extent it is applicable, that also. increased. As in previous slide I have shown you that it has been proved that short-term therapies have challenged the long-term. Overview of brief therapies. Psychodynamic approach. David Mellon and Triangle of Insight. The Word of Habib Devanlo. Anxiety provoking and anxiety suppression therapies. The work of James Munn. Cognitive and behavioral approaches, CBT and cognitive therapies, interpersonal therapies, problem solving therapies, computerized based CBT, and guided self help. So, these all are used as psychodynamic approach. I think we discussed this. Okay. Modern brief psychodynamic therapies have rooted into work of French and Alexander and French. David Mellon developed an intensive approach to time-limited therapy focused on resolving central problems. Mellon's method emphasizes carefully assessment, trial interpretation, and focus on the therapy relationship. So these are what the contributions in psychodynamic approach has been done by different psychologists. Habib's method involves pressurizing patients to uncover hidden anxieties and confront them directly.
Sir, slide
Yes,
reached at 17 at behavior therapies.
sorry, sir.
Slide reached at 17. Now it's 25. Okay.
Okay, okay. It was stuck, sir, but I was moving. Okay, 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 sir. Now it is moving, right?
Okay, sir. Now it's
Uh,
25.
okay, okay. Thank you. Okay, so these are the psychodynamic psychologists or therapists who have emphasizes on different like therapies in psychodynamic approach. Anxiety provoking and anxiety suppression therapists. Peter distinguishes between anxiety provoking and anxiety suppression therapies. Anxiety provoking therapy confronts defense directly and focus on limited dynamic change, while anxiety suppression therapy is more supportive. Therapy length is typically limited within a maximum of 20 sessions for anxiety-provoking therapies. Existential method of time limit therapy, psychotherapy. James Munn's existential method emphasizes the finite nature of time and focus on evoking the horror of its fitness, finiteness. Okay. Therapy consists of 12 sessions with a clear ending aiming to improve the patient's self-image. Okay, as they need to understand who I am, as we discussed in earlier slides about existential method. Cognitive and behavioral approaches. CBT focuses on functional analysis of problematic behavior and emotions. Cognitive therapy based on Beck's model emphasizes identifying and challenging unhelpful thoughts patterns. And then therapy length varies, but typically lasts between 8 to 20 sessions, with some CBTs being long term in practice. So, as we know, CBT has been practiced from long time, and each therapy, the sessions, the pattern is varying little bit from one another. Like existential has different. Here you see 12 sessions. Here you see in CBT 20 sessions. In anxiety provoking again 20 sessions. So that number of sessions vary. Interpersonal therapy, IPTs explore four problem areas: grief, role dispute, role transactions, and interpersonal deficits. So therapy is time limited, typically lasting between 9 to 12 months, and focus on specific techniques based on the agreed problem area. Okay, problem solving therapy (PST) is a brief treatment for depression based on cognitive behavioral principles, focusing on generating solution to current problem. So it problem solving therapy. Okay, like solution focused therapy (SFPT). Solution focus based therapy. It is also focusing on treatment for depression Therapy typically consists of about 6 sessions structured around 5 stages of problem solving. So, sorry. So it usually takes 6 sessions, and it is structured around 5 stages of problem solving, different stages. Computerized CBT. So as now you can see, since COVID has came, people are mostly using computer-based CBT, guided self-imaginary, even virtual mode as well. So computerized CBT and guided self-help are developed as a brief therapy approach to anxiety and depression. These approaches are aimed to reduce therapeutic contact time and make CBT more accessibility. So here also they are mentioning reduce therapist contact time and make CBT more accessible, typically involving self-help materials and computer-based intervention. So nowadays, if you see, there are a lot of therapies which have been converted into this platform, online platform with application base. So at home only, you can do the therapy and you can get help from that. Relational approaches, time limit dynamic therapy. So time limited dynamic psychotherapy is collaborative method that focus on developing a working model of interpersonal roles and interaction patterns. So again, it is focusing on interpersonal roles, so relationships. It is interpersonal, not intrapersonal. So we need to be careful with that. Interactions patterns, how to interact with others. Its aim is to identify maladaptive interactions sequences. Maladaptive interactions means when you are interacting with another person, what goes wrong, it leads to the conflicted argument or behavior. So defeating expectations and negative self appraisals. Okay, so it focuses on these things. The time limited is flexible depending on the clarity of the treatment focus, but maintains a time limited aptitude. So it maintains that time limit, time management, but it goes with like flexibility. It's not very rigid that it should be in these many sessions. Psychodynamic interpersonal therapy. It uses the therapeutic relationship as a means of learning about oneself in relation to others. The therapist collaboratively develops a shared language for feeling and explores unarticulated emotions in the context of an authentic relationship. Unarticulated, the emotions, the expressions which are not articulated, which are not made, but it is hidden. So try to uncover them. BRT, brief relational therapy, okay, focuses intensely on the here and now of the therapeutic relationship. So it focuses on the present rather than the past, here and now phenomena. Okay, therapists explore both patients and therapists' contribution to the interaction and engage in meta communication between about relational dynamics. Raptors and rapiers to the therapeutic alliance are seen as opportunities for gaining awareness of problematic relationship patterns. So again, it helps us to understand the maladaptive patterns of relationship or impaired patterns of relationship. Then we have CAT, cognitive analytic therapy. CAT is an integrative approach rooted in person-centered therapy. Again, it's rooted from humanistic approach, cognitive and developmental psychology, and psychoanalytic objective relations theory. It emphasizes repetitive sequence of cognition, emotion, behavior, and these consequences known as procedures. So, CAT is fundamentally interpersonal and relational, requires collaborative reflection on reciprocal roles unacted in the therapy relationship. Reciprocal roles means when, for example, if there is a conflict between two people, what the therapist is doing, they are interchanging their role. Okay, if you are at that place, how you would have acted in that? Because sometimes we feel that we will be doing the best thing, that person did not take the right decision at that position. So role play helps them according to that situation. Therapy begins with an extended assessment leading to a jointly agreed reformulation of the patient's story and its relation to their presenting issues. Okay. The ending of therapy is seen as an opportunity for growing, allowing the patient to work through unassimilated issues and enact new reciprocal role procedures. Pragmatic and electric therapies in brief. Okay, it's not. Let me show you what is this. Methods of child psychotherapy. Let me check the time. Oh, we have time. Okay. Oh, another important therapy is play therapy. Play therapy involves creating, because nowadays play therapy plays a very important role. As earlier we used to use other therapies, but nowadays people are like, usually you will see people showing this good recovery even in through using play therapy. So play therapy involves creating intense relationship experience between therapist and children. Especially play therapy plays an important role in child development, or especially when we are dealing with the kids, children. Okay, with play as the primary medium of communication, therapists use child's fantasies and symbolic play to understand and communicate with them effectively. Especially, for example, if there is a child who is autistic, or there is a child who is ADHD, or there is a child who has some other, autism is umbrella term, other any other uh, disorder with relate to autism. Okay, in that cases play therapy plays very important role to gain their attention, because usually they are lacking the attention. They will not have eye contact, they will not pay attention, they will not have social interaction. So play therapy plays their very important goal: decrease behavior and emotional difficulties that interfere with normal functioning. So what is the goal of behavior play therapy is, it decreases the behavior and emotional difficulties that interfere with normal functioning. If there is any hindrance in our normal day-to-day functioning, it will help us to reduce that, to decrease that. Improve communication and understanding between child and their parents. So it helps us to increase the communication between the parents and the child. Enhance verbal expression, self observation, impulse control, coping skills, trust and relational abilities. So see, if you see here again, impulse control, so which is usually in ADHD, there is like the issue of impulse control. So play therapy plays an important role in that. Addressing conflicts common to different stages of cognitive and emotional development. So it mostly focus on both cognitive as well as emotional development to address the conflicts it's have. Therapeutic process. So how this therapeutic process happen in play therapy? Therapists to observe and interpret the themes and patterns in the child's play to understand their thoughts and feelings. So therapist, as if you remember the movie Tare Zameen Pe, again freeze. Okay, is it now moving?
Yes, sir.
Okay.
So now I can see the play therapy.
Play therapy. Yes. Okay. So therapists to observe and
Yeah.
interpret the themes and patterns in the child's play to understand their thoughts and feelings. So what happens is, when a therapist observes the child through the pattern of play, they are able to understand why the child is lacking, what is the thought pattern of that. As I was giving an example about the movie Tare Zameen Pe, in that the actor is trying to understand the kid's behavior. So who is having dyslexia, that's a childhood related disorder, reading comprehension. Okay, so in that he's trying to observe where the difficulty is and what he was in good, like he could find that in art he is very good. Treatment may be combined with other interventions like medication for attention or anxiety issues or cognitive remediations for learning disorders. So it is not always we can go with one thing. We can only dependent, especially in such cases when, because okay, so this sort of behavior, if it is ADHD or if it is autism, so there will be some hormonal changes. Either some hormones will be up, some hormones will be down. So only therapy is not going to help that. So in such extreme cases, even if there is a person who is having very high depression, medication is very important to maintain that balance of the hormone in the brain. Okay, so same case here among children also, they need medication, but along with medication, that is why we have a team of, there should be a social worker, there should be a psychiatrist, there should be a clinical psychologist, there should be a counselor. Okay, so to understand or to treat such sort of disorder or problem, even schizophrenia, both therapy as well as medication plays very important role. If only one we are giving, it is very difficult to manage that client or that patient. So both should go simultaneously. Okay. Treatment progress through initial evaluation, middle phase of therapy, where the child becomes comfortable with the therapist, and final phase of ending treatment. Parent child interaction psychotherapy, PCIT. It is again very important. Target population is effective for abused or and at risk children with disruptive behavior and their caregivers. It is suitable when parent child relations are strained, interactions are poor, communications are problematic. Might have seen nowadays, especially kids and their parents' communication, always argument, always fighting. So in that cases, this therapy plays very important role. Treatment approach: therapists coach parents while they interact with their child. It's not only we have to correct the child, but parents should also get the training how to deal with the child in such scenario, using a one-way mirror and an earbud audio device to provide real-time guidance. Parent-child interaction therapy consists of two stages: relationship development, child-directed interaction, and discipline training, parent-directed interaction. So one is child-directed interaction and another is parent-directed interaction. So here the counselor has to interact with both child as well as parent. Child-directed interaction aims to foster a loving and nurturing bond between parent and child through play therapy. Parents are target a set of skills to use during daily play sessions called spatial playtime. Skills often follow acronyms like DRIP: describe, reflect, initiate, praise. Describe, describing something. Reflect, have reflection on that. Imitate, copying that. And praise, appreciating, or pride. Okay, pride is again praise, reflect, imitate, and describe enthusiasm. Then parent directed interaction. Earlier it was child directed, now we'll see parent directed interaction. Focusing on establishing structure and consistent discipline techniques, parents learn to give clear, direct commands and provide consistent consequences for compliance and non-compliance. So there will be those who are, for example, if a small baby, he is doing some good behavior, we will say, very good beta, you have done a nice job. Or if they are doing something which is not appropriate, we will say, stop, don't do it. So that is what consequences. You get appreciate or you get punishment. The development, individual differences, and relationship based model, DIR. Functional development level. This aspect focuses on understanding where the child is in terms of their development progress. It involves assessing the child's ability across various developmental domains such as attention, engagement, emotional signaling, problem solving, and imaginative interaction. So, in different aspects, it is important to measure the child's situation where he falls. So, sometimes, like chronological age is something, mental age may be something else. So it is very important to understand first what is the mental age, where the child or the client is falling, right? Okay. Individual differences in process, again we cannot generalize ki, okay, we are giving treatment if there is a group of 10 students, there are individual differences. Even in our class, teacher gives a lesson lecture to the students, but some scores very high, some scores very low. It is not okay. Sorry, I don't know what is the issue with this. Let me again check it. I hope it's now moving, right? Okay. So individual differences in processing. So some students or some kids will be understanding in shorter duration, some will take so much time. Okay, it again depends on their performance, on their IQ, on their ability to understand, on their ability to react. That's why we need to measure all their like attention, engagement, emotional signaling, problem solving skills, imaginative interactions. So that all plays vital role for the kids to in understanding. Then we have relationships. The R component emphasizes the importance of examining the interactive relationships within the family. So, how they are bonding with the other siblings, parents, and broader caregivers environment. So, how is the caregiver environment? So, if you remember, there is a psychologist who said, "Give me 100 kids, whatever you want me to make them, I will make them." So, environment, as per that theory, environment plays an important role in the development of a kid. It considers the quality of relationship and the use of effectiveness communication to support the child's development. The goal is to identify ideal patterns of interaction that promotes enhance development. So goal main focus is to identify the pattern of interaction and enhance the development of the child. Comprehensive assessment and intervention. So comprehensive assessment means when you are using this model, guided assessment and interaction. So what is the progress? For example, you are conducting 3 sessions or 4 sessions with the kid. So it should be having comprehensive assessment. In between, during the intervention also, what is the progress? Sometimes what happen is we need to change the intervention. We need to give the gap. We need to do something else. Okay. So to have a track record, we need to get that comprehensive assessment as well. Components of intervention. Intervention based on DIR model may include semi-structured problem-solving activities. It can be semi-structured problem-solving activities, learning interactions, speech therapy, occupational therapy, peer play opportunities. So there are n number of components in the intervention. So now it depends with the problem, what the problem child is having. These interventions aim to support the child's overall development and enhance their ability to relate to others, communicate effectively, and engage in abstract thinking and empathy. Comprehensive framework. The DIR model is recognized as one of the most comprehensive conceptual framework available for understanding and organizing assessments and intervention programs for child with special need. Those who are in a special need, for example, child with differently able or who are in special need, right? So it works for them. Okay, it is known for that. It has been instrumental in helping children with autistic spectrum disorder, improving their social skills, communication abilities, and cognitive functions. So, studies have shown, empirical evidences have shown that this DIR model helps kids who are under autism spectrum. It helps them to enhance their social skills, communication abilities, as well as cognitive function. Behavioral modification techniques. Okay, so now we'll be talking about behavioral modification techniques. I hope slides are now correctly. Okay, so yes. Okay, characteristics of behavior modification. So, what are the characteristics of behavior modification? Number one, focus on behavior. So, it's more focus is on behavior only. So, when we talk about behavior modification, so more focus is on behavior. Procedures based on behavioral principles. So, what are the procedures they are using in the behavioral modification? These are based on the behavioral principles. Emphasizes on current environment event. So it emphasizes on current environment, which environment you are in, it focuses on that. precise description of behavioral modification procedures. So it gives you a specific, objective description of behavioral modification procedure. Treatment implemented by people in everyday life, measurement of behavior change. So again, assessment of the behavior modification is again very important. So that's why even in college schools we usually used to have a lot of exams, internals, cat, pat, like n number of exams, which gives us the performance of the kid, how they are doing entire in different semesters. Otherwise, if there is no measurement, how we will be able to identify whether the intervention we are giving is making any change in the client or not? They emphasize on past events as cause of behavior. So again, we are not trying to focus on the past events which have caused the behavior, but we are trying to focus on the current behavior to change it in an appropriate behavior. Rejection of hypothetical underlying causes of behavior. So again, we are trying to reject hypothetical underlying cause. What all hypothetical causes people have? So we are trying to reject that, and we are trying to change the behavior, modify the behavior. Major figures. So as we have discussed about Ivan Pavlov, who have done experiment on that dog. Pavlov conducted experiment that uncovered the basic process of respondent conditioning, how conditioning happens. Then Edward Thorndike's major contribution was to describe description of law of effect. Then we have John B. Watson in his article Psychology as a Behaviorist View, it published in 1913. Then we have B.F. Sickner, who again did an experiment on a rat. By he has discussed about positive reinforcement, negative reinforcement, punishment, that help us to a large extent in modification of behavior. Respondent conditioning. Respondent conditioning is also known as classical conditioning or Pavlovian conditioning. Involved the association of neutral stimulus with an unconditional stimulus to elicit a conditional response. So what happened in this is we had a natural stimulus, we had a conditional stimulus. If you see, neutral stimulus was food, conditional stimulus was bell. Then response. Initially, it was saliva was the response in that. Whenever food was presented to the dog, it used to stimulate saliva, right? That was conditional. Later on, that only becomes unconditional. Conditional. That was unconditional response. Whenever we get food, it will be unconditional response, saliva. Okay. The unconditional stimulus neutrally elicits an unconditional response, UCR. So you need to also remember these terms. UCR means unconditional response, UCS means unconditional stimulus, CR means conditional response, CS means conditional stimulus. Okay. Through repeating pairing with the UCS, the neutral stimulus become a conditional stimulus, CS, that elicits a conditioned response similar to the unconditional response. For example, if a child associates the sight of a needle with the pain of an injection, they may develop a fear of or anxiety response to the sight of a needless. Needless, right? Respondent conditioning is used to explain how learned associations between stimuli and response contribute to emotional reactions and phobias. That's why the therapies based on classical conditioning are very much helpful in phobias. Even aversion therapy we have, which we already discussed. Counter conditioning. Counter conditioning aims to reduce or eliminate undesired responses by pairing the eliciting stimuli with new, more adaptive response. This process involves identifying the situations that elicit the undesired responses and establishing ways to elicit incompatible responses that dominate over the undesired response. Counter conditioning is opposite to conditioning actually. Through repeated pairing of new response with the eliciting stimuli, counter conditioning aims to weaken the desired response until it no longer occurs. For example, someone with a fear of spiders may undergo counter conditioning by pairing relaxation techniques with exposure to images or description of spiders gradually reduces their fear response. So, if a person is having fear of spiders, can go and may undergo counter conditioning by pairing relaxation techniques with exposure to images. Okay, so they are getting exposure to images or descriptions of spiders. That will help them to reduce the fear. Okay, counter conditioning also can be used to address approaches responses to stimuli associated with addictive behavior, such as pairing adverse stimuli with cause related to substance abuse. So, like how this aversion therapy is used, when you are trying to smoke, that time only you are getting current. So it again like gives you the current, then you will be able to you are not able to go with that. Then it will give you a current. Like oh. Then operant conditioning, reinforcement and punishment, any event that increases the likelihood of a behavior occurring again in the future. Reinforcement is when we are giving something to enhance the behavior. Punishment is when we are taking something, any event that decreases the likelihood of a behavior occurring again in the future. Types of reinforcement and punishment, we have positive reinforcement, negative reinforcement, positive punishment, negative punishment. So positive reinforcement, increasing the probability of a behavior by adding a desirable stimulus or consequence. When we are trying to increase the likelihood of a behavior by adding something, you are getting first division, I am giving you a chocolate. So I want you to continue this behavior, so next semester also you will get a first division. So I am adding you something, and because you are getting a first division. Okay, that is positive reinforcement. Negative reinforcement, increasing the probability of a behavior by removing an adverse stimulus or consequence. Okay, so increasing the probability of a behavior, you study more, then only I am not allowing you to watch movie, I am taking your remote so that you will finish the homework. I want to increase your behavior of working on your homework by taking your remote or not allowing you to watch the TV. Okay, so increasing the probability of a behavior. I want to increase your behavior by removing something. Above it was positive reinforcement, increasing the behavior by adding something. So there I am giving you chocolate. Here I am taking your remote to watch the movie. Now punishment, positive punishment, decrease the probability of a behavior. Here we are decreasing the probability of behavior by adding an adverse stimulus. If you fail, your parents will beat you. Okay, they are adding you beating. Okay, so it will decrease your probability of again getting failed. Decreasing the probability of a behavior by removing a desirable. You could not score good, your cycle is being taken back by your parents, or mobile phone is being bad, so you need to work on that. What text are coming? Okay, then we have one. Then we have increasing desirable behavior. Reinforcement is key in operant conditioning to boost desirable behavior. So reinforcement, even in class, we are using reinforcement. Very good beta, like that, or we are giving good or token economy. That all help us to enhance the desirable behavior. Identifying individual preferences for reinforcement is crucial. Self reinforcement plays a role in self control and process. When sometimes we get self reinforcement, oh shabash, I did a good job, right? Strategies like shaping, modeling, fading, and guidance help initiate behaviors. Okay. Variables of reinforcement. Amount of reinforcement impacts behavior with more reinforcement leading to strong effects. Okay, even amount of reinforcement. If you might have seen that kids, when they get good marks, they will have expectation. Okay, I want this thing. Next time they will have more. If you get more, you will try more harder, right? Increment. When you are working somewhere, if you get more increment, you will work more. So that's what amount of reinforcement impacts behavior. So what is the amount of reinforcement will have impact on the behavior. With more reinforcement leading to strong effects. Delay of reinforcement affects effectiveness. If your salary you are supposed to get on 31st or 30th or end of the month, if you are getting it delayed, then your motivation to work will not be that much. With immediate reinforcement being more impactful, if you are finishing the class, you are getting the reinforcement that will work more effectively. Schedules of reinforcement, whether continuous or intermittent, influences learning and maintenance of behavior. Schedules, if we keep it on schedule means, okay, every 30th page you are filling, you will get a reinforcement, or every 30th task you will get, so you will try to finish till reach 30th, right? Facilitating generalization and maintenance. After establishing behavior in specific settings, it is essential to facilitate their generalization and maintain in other environments. Strategies including phasing clients of specific behavior change reinforcements into more natural forms of reinforcement, gradually exposing clients to natural reinforcement contingencies and reprogramming other environments, or enlightening support from others to reinforce newly acquiring behavior. So strategies include phasing clients of specific behavior, change reinforcement into more neutral form of reinforcement. So again, changing and reinforcement, that also plays. So one time you are getting something, next time you are changing it with new reinforcement, it again helps. If every time you are getting some particular thing only, then it won't be that effective. Contingency contracting. Specific operand contingency is clearly and is often written, involves negotiating contracts to ensure understanding and agreement. Is powerful tool in classroom setting for behavior management. Contingency, this thing. So you are you when people are, I have seen people who are doing PhD and all, there will be contingency amount. Contingency amount is that which you use for, especially in PhD, for this. Like books, notebooks, paper, pen, and all. Okay, contingency contracting again helps us to modify our behavior. Especially it helps in students population. Consistency in contingency contract. Consistency is crucial for behavior change program to be effective. If it is a consistency, okay, every month if you complete this much work, you will get this thing, so that contingency will be there. So it is showing more effective progress. Inconsistency can lead to uncertainty, anxiety, and other problems. So if there is inconsistency in contingency, it will lead to anxiety and other problems. Contingency contracting promotes consistency and mutual fulfillment of contact terms. So it helps to promote consistency and mutual fulfillment of whatever they are doing. Operant conditioning involves reciprocity, and contingency contracts establish satisfy reciprocal among involved parties. So operant conditioning plays a role in reciprocity, and contingency contracting establishes satisfying reciprocal among involved parties. Okay. Token economy. Clients are reinforced with tokens. For example, if you are doing this part, you will get one good. Then you are doing another task, you will get another good. So once you get, like we are paying credit card bills, that is how token economy. You are getting coins. So when you are doing this much, you will get these many coins. When you collect, if you have 1,000 coins, even in Paytm, we used to get coins, right? Yeah, okay. So in Paytm also we used to get coins, which helps us with money as well. So that's what token economy are widespread in various settings. Okay. Tokens earned can be exchanged for a variety of reinforcers, reducing the risk of set shift. Reinforcement and can be depends in immediately after desirable behavior. So if you collect undesirable behaviors are which I don't like or which we don't want. For example, coming late to a class is an undesirable behavior. How to decrease that? Extinction is uh, termination the contingency between a behavior and the contingent event. Withhold reinforcement decrease the probability of the behavior. Inefficient for large behavior hierarchies better to reinforce desired behavior. So what we does is terminating the contingency between the behavior and its contingent. What we are doing is suppose, for example,
No audio, sir.
yes sir. Okay sir.
Now okay, sir.
Okay. Okay. So yeah. Hmm. Then we have extinction is done, then punishment. Common approach to reduce undesirable behavior. So you know punishment is like when we are, it's not like just beating with this thing stick. So common approach to reduce undesirable behavior, we use punishment consisting of applying a contingent event resulting to decrease behavior probability. Types: positive punishment, adding adverse stimulus, and negative punishment, removing reinforcement stimuli. So it can be adding something which is adverse, giving pain or torturing or beating, or it can be removing something. For example, when you are enjoying TV and all, when you are scoring less marks, your parents are not allowing you to do that. Poor corrections involving practices correct behavior or correcting consequences for misbehaviors. Positive practices. So if a child, usually it happens in poor corrections, if they do something, they start walking, we said yes, very good baby, you are trying to do it, nice. If they put something wrong in their mouth, we will say stop, it's not good. That's what over corrections are there. So with this we will stop here. Now if you guys have any question, please feel free to ask me. Any questions? Any suggestions?
So do we have any one more session for the same and for psychotherapeutic paper?
Sorry, Anas, I am not able to hear you. I think.
So do we have one more session for do we have one more session regarding this paper?
Okay, regarding this paper, that sir will reply you. While sir is there, I don't think so.
Sir, attending another meeting, sir.
Okay, okay, no issue, no issue. So if there is something, then they will let you know. But I don't think so. I will be sharing the material today only to sir. He will send you the PPTs. That I can do as of now. Yes. Any other question or any other suggestion?
Then okay, sir, we will wind up.
Okay, okay. Thank you so much for listening patiently. Okay, thank you. Sir will be sending